A couple of brief questions from Dean Russell and James Davis. Dean.
Thank you, Chair. And can I also share my thanks to the social care workers through yourself, Minister. I was speaking recently to Camille from Abbott's Care in my constituency, and she was saying one of the big concerns that's coming through from care homes and from home care workers is the rise in insurance premiums. They're really worried that they're getting outpriced and are not going to be able to take in patients that perhaps had coronavirus previously, and it's potentially, especially with the rise that we're going through at the moment, going to cause a massive backlog of providers not being able to take patients from hospitals because they just can't afford the risk of doing it. Is that something that's being looked at, please? Because I think it's going to be a really big issue over the coming months.
Yes, absolutely, that is something that is being looked at. I'd say it's being looked at along with the broader question of the financial viability of the sector and the extra cost that the sector is bearing, recognising the extra costs in social care. That's one reason why we're now distributing free PPE to meet adult social care's needs over the winter, and the Infection Control Fund is in place specifically to fund extra costs associated with COVID, like the extra workforce costs and sick pay for staff, which is really, really important. But we are indeed also looking at the rising insurance costs.
Thank you.
Thank you. And just ask how quickly that will be prioritised in terms of helping care homes right now. Sorry, last question.
I can say we absolutely are looking at it and keeping a very close eye on it, along with working with local authorities, with ADAS and LGA, where local authorities have the responsibility, the statutory responsibility for the local care market and making sure that there is provision of care to those who need it. So we're clearly working closely with local authorities for that reason.